All right, get ready. We're diving deep into breast anatomy and embryology today. Sounds a little dry, maybe, but trust me, it's a fascinating journey, even if you don't have a medical degree. We'll be using excerpts from a medical textbook chapter as our guide.
Yeah, think aha moments, not medical school lectures. We're going to uncover what makes this topic so interesting no matter who you are.
So we're tracing breast development from, well, the very beginning. We're talking about that first whisper in the womb, all the way to adulthood, intricate structures, hormones, even some fun facts to share at your next dinner party. You game.
Absolutely. You might be surprised how early this journey actually begins. We're talking week 4 of gestation. That tiny little embryo.
Week 4. Whoa, that early. What's
Ah,
even happening at that stage? I mean, are we talking like a mini breast just appears?
Not quite, but it is pretty mind-blowing. At week 4, breast tissue actually starts forming from the same layer as our skin, the ectoderm. It's like our bodies are saying, hey, let's dedicate a patch of skin for future generations.
Okay, so no mini-me breast just popping up. It's more like a process.
Definitely a process. And get this, around week 6, a structure called the mammary ridge forms. It runs all the way from the armpit down to the groin. Wild, right?
Right.
But then, most of it disappears.
Wait, what? So we all start with this potential breast tissue running down our bodies. Then it vanishes. Why would humans evolve like that?
That's a great question. There's a theory that way back in our evolutionary history, our ancestors might have had multiple breasts, kind of like some mammals today. But then as we started walking upright and using our hands more, having 2 breasts became more advantageous.
Oh, that makes sense. So the disappearing milk ridge is like an echo of our past. Okay, so we're left with this portion of the chest area, and that's where things really get going.
Right. A primary bud emerges, then a secondary bud, and eventually we get those lactiferous ducts. Those are the channels for milk transport. Oh, and here's a fun fact for you. They're actually modified sweat glands.
Sweat glands. Hold on, the stuff that keeps us cool is related to what nourishes babies.
Mm.
That's wild. Nature definitely has a sense of humor.
Definitely. By month 5, we start seeing the mammary pit, the areola, and the milk-producing achini taking shape. But, sometimes there are those little developmental quirks.
Quirks. Okay, now you've got my attention. What kind of quirks are we talking about?
Remember that mammary ridge that mostly disappears? Well, sometimes those remnants can lead to, say, extra breasts called polymastia, or extra nipples called polythelia.
Extra breasts, like more than 2. Now that's a dinner party story. How common is that?
Polythelia is actually more common than you'd think, about 2% of the population. It often pops up along that original milk ridge pathway, usually just below the breast on the chest wall. Makes you wonder, right? You probably know someone with it and never even realized.
Wow, yeah, mind blown. Okay, so now we have these little proto-breasts. When do they really kick into gear?
Puberty. That's when the magic happens, usually between 10 and 12 years old. It's all about this intricate hormonal dance that leads to those mature breasts.
Ah, yes. Hormones. Those puppet masters of puberty. Break down this hormonal dance for me.
Imagine this. It starts in the brain. The hypothalamus releases gonadotropin-releasing hormones, GnRH for short. GnRH signals the pituitary gland to release 2 other key hormones, follicle-stimulating hormone, or FSH, and luteinizing hormone, LH.
Okay, FSH and LH. Vaguely remember those from biology class. Don't they do something with the ovaries?
You got it. FSH gets those ovarian follicles growing, and that leads to the release of estrogen. And estrogen, think of it as the duct lengthener. It promotes the growth of those breast ducts.
Estrogen, the duct lengthener. Got it. What about progesterone? Where does it fit into this breast symphony?
Progesterone comes in a bit later after ovulation. The corpus luteum, which forms after an egg is released, is the one pumping out progesterone. Working together, estrogen and progesterone, they orchestrate the final development of the breast tissue.
So it's a team effort. Estrogen gets things going, and progesterone fine-tunes the whole thing. But where is all this happening? What are these breasts developing in?
Good question. All of this is going on between layers of the superficial fascia, basically a sheet of connective tissue. These layers are held together by, you guessed it, Cooper's ligaments. They're key for supporting all that new breast tissue.
Cooper's ligaments. Okay, that rings a bell. They help maintain breast shape, right?
Exactly. We'll get to those in more detail later. But for now, let's talk about how we visually track breast development during puberty. Have you heard of the Tanner stages?
Oh, yeah, the Tanner stage. It's like a puberty roadmap, isn't it?
It is. It's a way to categorize breast development based on, well, what you see. There are 5 stages, starting with stage 1, where there's no noticeable breast tissue, then all the way to stage 5, the mature adult breast.
Got it. So doctors use this to assess if everything's on track during those interesting teenage years. Each stage has specific features, right? Like the appearance of that glandular tissue, changes in areolar pigmentation, how much the nipple sticks out.
Exactly. But let's not forget the menstrual cycle. Even after puberty, breasts go through these subtle changes every month in sync with the cycle. It's like a monthly mini makeover.
Oh yeah, I can attest to that. Some days, they're tender and full. Other days, practically invisible. What's the science behind that?
Think of it like this. During the follicular phase, days 4 to 14 of the cycle, you have a surge of cell division and growth in the breast tissue. It's like a mini growth spurt for those cells.
Ah, that explains the fullness. Then comes the luteal phase, right? Days 14 to 28, progesterone's time to shine.
Right. Progesterone's job is to get those milk ducts ready for potential milk production. Estrogen's pumping up the blood flow, making everything a bit more noticeable.
And then right before our period, estrogen peaks, leading to that lovely tenderness and swelling. Makes sense.
Exactly. Then, when your period starts, hormone levels drop and the breasts go through involution, back to a less active state. It's this beautiful cycle of growth, preparation, and rest.
Our bodies are incredible, so responsive. And speaking of changes, we can't forget pregnancy. That's a whole other level of
Maybe you
transformation.
said it. Pregnancy is like breast evolution in overdrive. It's all about the hormones. Again, estrogen, progesterone, placental lactogen, prolactin, and chorionic gonadotropin. A whole team prepping those breasts for lactation.
It's amazing how our bodies anticipate those needs. So how does this transformation unfold? What happens throughout the different trimesters?
In the first trimester, estrogen kicks off the show. Ductular sprouting, lobular formation, the breasts get bigger, veins more prominent, the nipple areolar complex gets more pigmented, getting those milk-making factories up and running.
And then second trimester, progesterone steps in,
Yeah.
guides lobular development, and that's when colostrum starts collecting in those alveoli, right? Those tiny milk sacs.
Exactly. And get this. By the third trimester, breast size can triple. Vascular engorgement, cell proliferation, colostrum accumulation, it's all go.
Triple. Wow. But what happens after delivery? I mean, the placenta's gone, so those hormones drop, right?
You got it. That's when prolactin from the anterior pituitary gland steps up to the plate. Prolactin's the MVP of milk production.
And let's not forget oxytocin from the posterior pituitary. That's the one triggering milk ejection.
Right. And what's cool is that nursing itself stimulates prolactin and oxytocin release. It's a feedback loop, supply and demand, all built in.
Nature is so smart.
Not
So after breastfeeding, do breasts just go back to their pre-pregnancy state?
exactly. It's a gradual involution process, takes about 3 months. That extra lobular tissue regresses. Oh, and there's menopause too. Can't forget that hormonal roller coaster.
Ah, right. Menopause. What happens to the breast then?
Well, that glandular tissue gradually gets replaced by fat.
Fascinating. Okay, we've covered breast development from embryo to, well, beyond. But what about the nitty-gritty anatomy? What's going on under the hood, so to speak?
Now we're getting to the good stuff. Let's start with the vascular system, that network of highways and byways that delivers blood to the breast tissue. Super important for oxygen and nutrients, especially during those growth spurts and milk production phases.
Okay, let's map out these vascular highways. What are the key things we need to know about the blood supply to the breasts?
Think of it as a dual system. You've got the subdermal plexus, taking care of the skin. Then you've got the deeper vessels branching off to supply the actual breast tissue, the parenchyma. It's like a network of main roads and side streets all working together.
So the skin has its own blood supply, and the underlying breast tissue has a separate one. Makes sense. What are the main sources of blood for that deeper tissue, the parenchyma?
It's a team effort. You've got branches from the internal mammary artery, the lateral thoracic artery, the thoradorsal artery, intercostal perforators, even the thoracoacromial artery. It's a redundant system, meaning if some vessels get compromised, the breast can still get the blood it needs.
So it's like a backup system. That's reassuring. What about the nipple areolar complex, the NAC? I'm guessing that area has a pretty important blood supply, right?
Absolutely. The NAC gets blood from both the subdermal plexus and those deeper vessels supplying the parenchyma. Double dose of nourishment. Now, we should probably touch on venous drainage too, which is how blood flows back out.
Okay, so how does that work? Does it basically mirror the arterial supply?
Pretty much. The venous drainage generally follows the same pathways as the arterial supply, with most of the blood flowing back towards the axilla, the armpit. Now, You might be wondering why we should care about all these blood vessels, right? Seems like medical trivia.
Yeah, sometimes it feels like I'm drowning in anatomical terms. What's the practical significance of understanding the breast's blood supply?
It's actually super important for things like surgery. You see, the breast has this amazing ability called arterial collateralization. It can survive on a fraction of its normal arterial input thanks to all those interconnected vessels.
So even if some blood vessels are cut during surgery, the breast can still thrive.
Exactly. That's why surgeons can remove parts of breast tissue or lymph nodes without compromising the viability of the remaining tissue. The human body's resilience is incredible.
That is impressive. Makes you appreciate the intricate design of our bodies. Okay, let's move on to another crucial part for their nerves. What can you tell me about the nerve supply to the breasts?
Well, the breast's innervation follows a dermatomal pattern. Specific nerves correspond to specific areas of skin. We're mainly talking about the anterolateral and anteromedial branches of the thoracic intercostal nerves, specifically T3 through T6.
Okay, so those nerves handle sensation in the breast. But what about the NAC, that nipple areolar complex? Does it have its own nerve supply?
Of course, the NAC gets its sensory input from the anteromedial and anterolateral branches of the T4 intercostal nerve. It travels along the pectoral fascia to reach the NAC's deeper surface.
So if someone has numbness or tingling in their NAC, it could be a T4 intercostal nerve issue?
Could be. And there's another important nerve, the intercostobrachial nerve. It travels across the axilla and supplies the upper medial arm.
Why is that one so important?
It can be vulnerable during axillary dissection, a common procedure during breast cancer treatment where lymph nodes are removed from the armpit. If the intercostobrachial nerve gets injured, it can cause numbness or pain in the upper arm.
Oh, I see. So surgeons need to be very careful around that nerve.
Exactly. They're very careful to identify and protect it to avoid those complications.
This is all so intricate. It's like this delicate tapestry of nerves and blood vessels all woven together. It's amazing how much complexity is packed into this one part of the body.
It is. And it gets even more fascinating when we look at some of the anatomical studies that have been done on the breast. Some truly remarkable findings.
Okay, I'm ready for more anatomical revelations. What kind of insights have these studies provided?
Well, for example, Schlentz and his team did a study on female cadavers and found that the innervation of the NAC is remarkably consistent. Specific branches of the third through fifth intercostal nerves are responsible for sensation in that area. Really valuable for surgeons.
So it's like a roadmap of the nerves. That's got to help guide surgical decisions and improve outcomes. Are there other studies that have provided similar insights?
Absolutely. One of the most groundbreaking was done by Wieringer and his colleagues. They were looking at the connective tissue support system within the breast, and they discovered a brassiere-like connective tissue suspensory system.
Wait, a brassiere-like support system? You mean like a built-in bra?
You could say that. It includes a structure called Wieringer's septum, which not only defines the borders of the breast tissue, but also carries those vital neurovascular structures, including the main nerve to the nipple.
Wow, so it's not just a random jumble of tissue in there. It's organized, providing support and maintaining shape.
Precisely. Oh, and we can't forget O'Day and his team. They mapped out the arterial distribution patterns in the breast, identified 4 distinct arterial zones, and looked at the safety of different pedicles, which are flaps of tissue used for reconstruction.
So their research helps surgeons choose the best pedicles for breast reconstruction, ensuring good blood flow.
Absolutely. It's amazing how these anatomical studies have advanced our understanding and surgical techniques.
This is also fascinating. It's amazing how much is going on beneath the surface. I'm eager to learn even more.
Well, we're just getting started. Now that we've covered the blood vessels, nerves, and some of the key anatomical studies, let's dig into the tissues that make up the breast.
Okay, let's peel back those layers and see what we find. Okay, I'm back and still processing all those anatomical details from part 1. It's amazing how much is happening beneath the surface.
Right. It really is. Now that we have a handle on those underlying structures, the blood vessels, the nerves, that cool connective tissue system, let's talk aesthetics. After all, breast shape and appearance are pretty important for a lot of people.
Okay, let's get into aesthetics. What makes a breast, well, good looking? Is it just about size?
That's a common misconception. Size is just one piece of the puzzle. It's really about overall harmony and balance. Ideally, a breast should be a bit less full in the upper pole, above the areola, and fuller in the lower pole, below the areola. That creates a nice gentle slope, a more youthful appearance.
So it's about proportion,
Yeah.
how that volume is distributed. Like a well-composed photo, everything needs to work together to create a pleasing image.
Exactly. And of course, the ideal shape should harmonize with the proportions of the chest, the torso, even the buttocks. It's all about creating a balanced silhouette.
I like that, harmony and balance. Creating a look that complements the individual's whole physique. I've heard that surgeons use specific measurements to assess breast aesthetics. What are those?
Oh, absolutely. There are a few key measurements surgeons often consider. For instance, the location of the nipple areolar complex, the NAC. Ideally, it should be positioned about 19 to 21 centimeters from the sternal notch, that dip at the top of the breastbone. About 9 to 11 centimeters from the midline, and about 7 to 8 centimeters from the inframammary fold.
So there's a sweet spot for nipple placement.
You could say that. It's all about achieving balance and harmony. Surgeons also look at medial cleavage, that inward curve of the breast towards the center. The ideal amount depends on the individual's anatomy, specifically where the pectoralis major muscle originates and how far the breast tissue extends inward.
So some people naturally have more medial cleavage than others.
Exactly. And here's a fun fact. Perfect symmetry is actually quite rare. Most women have slight asymmetries in their breasts. It's part of what makes each of us unique.
So those tiny variations are nothing to worry about. It's part of our individual beauty. But I imagine surgeons still try to create symmetry during procedures like breast augmentation.
They do. They meticulously assess and document any pre-existing asymmetries before any procedure. It's about creating a final result that's as symmetrical and aesthetically pleasing as possible while working with the individual's natural anatomy.
That makes sense. Now, what about this breast footprint thing I've heard about? What is that?
The breast footprint is essentially the area of skin on the chest wall that the breast sits on. It's the base, the foundation, essential for providing stability and support.
So like the foundation of a house. Gotta have a strong foundation for a stable structure.
Perfect analogy. And just like a house, the breast footprint has boundaries. We define these boundaries using 4 key landmarks.
Okay, tell me more. What are these landmarks?
All right, first you have the upper breast border, the line where the breast tissue meets the chest wall at the top. Then there's the inframammary fold, the crease separating the lower edge of the breast from the chest wall.
Okay, the inframammary fold, that's the lower boundary. What about the sides?
For the sides, we have the medial breast border, where the breast tissue meets the sternum in the center of the chest. And then there's the lateral breast border, where it extends outward towards the side of the body.
So connect those 4 points and you've got the breast footprint outline. But why is it so important?
It's crucial for surgical planning, especially for augmentations or reductions. Surgeons use the footprint to determine the right size and placement of implants, for example. Or, in a reduction, it helps them plan how much tissue to remove to achieve the desired size and shape.
Like a blueprint, guides the surgeon's hand and ensures the best outcome.
Exactly. Now let's talk about mitosis, the medical term for sagging breasts. It's a common concern, especially with age or after pregnancy and breastfeeding.
Ah, yes, mitosis.
Yeah.
We talked about Cooper's ligaments earlier, those fibrous bands that support breast tissue. How do they factor into mitosis?
Cooper's ligaments are vital for preventing sagging, but over time those ligaments can stretch or weaken. Aging, gravity, the weight of breast tissue during pregnancy and breastfeeding, even weight fluctuations can play a role.
Like a rubber band losing its elasticity.
Perfect analogy. And when those ligaments can't support the tissue as effectively, gravity wins and we start to see drooping.
So that's ptosis in a nutshell. Are there different degrees of ptosis?
Yes. Ptosis is often categorized based on where the nipple sits relative to the inframammary fold. There are 4 main grades.
Let's hear them.
Okay, grade 1 is mild ptosis. The nipples at or slightly below the inframammary fold. Grade 2, moderate mitosis, is when the nipple falls between the fold and a point halfway between the fold and the lowest point of the breast.
So the nipple's dropping further down in grade 2. What about the more severe cases?
Grade 3, severe ptosis, is when the nipple's below the lowest point of the breast. Then there's grade 4, pseudoptosis. This one's interesting. It's not about nipple position. It's when there's excess skin and tissue in the lower breast, making it look saggy, even if the nipple is still above the inframammary fold.
So the breast tissue itself has lost its structure, kind of folding in on itself.
Exactly. And the degree of saposis can impact the type of surgical approach that's recommended. For instance, a breast lift, or mastopexy, can be used to lift and reshape those sagging breasts.
It's amazing what surgery can do to help women feel more confident. We've talked about ligaments and their role in breast shape. But what about the muscles? What's their role in all of this?
The underlying muscles are definitely key players in breast aesthetics. We mentioned the pectoralis major earlier, that large fan-shaped muscle covering the upper chest. It provides a foundation for the breast, affecting its projection and fullness.
So a stronger pectoralis major would mean a more lifted, perkier appearance.
Exactly. Then we have the serratus anterior, along the side of the chest wall beneath the pectoralis major. It helps create a smooth contour, providing support to the lateral aspect of the breast.
So the serratus anterior is like a supporting actor, helping shape the sides and define the contour.
Great analogy. And we can't forget the rectus abdominis, those six-pack muscles. While they don't directly support the breast tissue, they contribute to the definition of the lower chest and abdomen.
Right, a toned abdomen can enhance the overall silhouette, make the breasts appear more lifted.
Absolutely, and the strength and tone of these muscles do matter. Exercise, especially targeting the chest and core, can improve muscle definition and enhance breast appearance.
So hitting the gym is good for your health and your breast aesthetics. Win-win.
Exactly. While exercise can't change fundamental anatomy, it can definitely make a difference. Now, we've talked muscles, ligaments, even fat, but there's another element we need to consider, the rib cage.
The rib cage. How does that impact breast appearance?
Well, the rib cage is like the frame for the breasts. Its size and shape can affect how the breasts project. Someone with a narrower rib cage might have more projected breasts, while someone with a wider rib cage might have less projection, even with the same volume of breast tissue.
It's like framing a painting. The same artwork can look totally different depending on the frame.
Perfect analogy. We can't change our rib cage size, but understanding its influence helps surgeons create the best outcome for each patient.
I'm starting to see the breast not as just one thing, but as layers of anatomy working together to create its unique shape.
It is a symphony of muscles, ligaments, fascia, fat, and bone, orchestrated by those vascular, nervous, and lymphatic systems. Truly a masterpiece of nature.
Speaking of masterpieces, let's dig into those anatomical studies. I love hearing about those aha moments in research.
There have been some incredible findings. One area that's really fascinating is the sensory innervation of the NAC, the nipple areolar complex. Remember, it's super sensitive and crucial for breastfeeding.
Right, the command center for lactation. What have researchers discovered about the nerves there?
They've been able to map those nerve pathways with incredible precision. It's essential for surgeons. Knowing exactly where those nerves run helps them avoid causing damage during procedures.
It's like a GPS for the nerves, minimizing the risk of complications.
You got it. One of the pioneers was a researcher named Schlentz. He and his team did these meticulous dissections on female cadavers and were able to identify the specific branches of the intercostal nerves that supply sensation to the NAC.
So they created a roadmap of the nerves, which has led to better surgical techniques and patient outcomes. What were those specific nerves?
The research showed that the NAC gets sensory input from both the anterior and lateral cutaneous branches of the 3rd through 5th intercostal nerves. Typically, the lateral cutaneous branch supplies the back of the nipple, and the anterior cutaneous branch takes care of the medial side. Pretty cool, right?
It is. Each part of the breast has its dedicated nerve supply. Makes sense. Did their findings have other implications?
Absolutely. It's been incredibly helpful for surgeons performing augmentations, reductions, and reconstructions. By carefully identifying and preserving these nerves during surgery, they can significantly reduce the risk of sensory loss or changes in nipple sensation after the procedure.
Research making a real difference. That's great to hear.
Absolutely. Speaking of groundbreaking research, let's talk about Werringer and his team again. They were the ones who uncovered that brassiere-like connective tissue support system.
Oh, yes. The built-in bra.
Right. And they found that the main nerve to the nipple, the lateral cutaneous branch of the 4th intercostal nerve, consistently runs within the system in a structure called Werringer's septum.
So it's not just support. It's a protective pathway for the nerve supplying the nipple. That's amazing.
It is, and it's a crucial finding for surgeons, especially when operating on the lower breast. They need to be mindful of Werringer's septum and that nerve to avoid damage.
Like a delicate dance, navigating those intricate structures.
Exactly. Now let's focus on the arterial supply. Remember, the breast receives blood from multiple sources, but understanding how those arteries distribute within the breast tissue is really important.
So it's not just about which arteries, but how they branch and nourish all those different tissues.
Right. A team led by O'Day did some groundbreaking research using arterial injection techniques, which allowed them to actually visualize the blood vessel network within the breast.
So they were able to create a detailed map of the breast's vascular system.
Exactly. They found that the breast is divided into 4 distinct arterial zones, each supplied by a different set of arteries. The largest zones are supplied by branches of the internal mammary artery and the lateral thoracic artery.
So those two are the main players in the breast's blood supply.
You got it. O'Day's team also looked at the safety of different pedicles for breast reconstruction. They found that those based on the internal mammary artery or the lateral thoracic artery were the most reliable for maintaining blood flow.
So their research directly helped improve surgical techniques.
Absolutely. They help surgeons pick the best pedicles, which means better outcomes and fewer complications.
Wow, it's incredible how much research has gone into understanding the breast.
I know. It's a complex organ, and the more we learn, the better we can care for it.
Okay, we've talked about the support system, the blood supply, and even the nerves. Let's get back to the basics. What are those two main layers of the breast, the skin and the parenchyma, that glandular tissue responsible for making milk?
Okay, let's break those down. The skin of the breast is really unique. It's thin and delicate, especially around the nipple and areola. That thinness is what allows for the transmission of those sensory signals. It makes those areas super sensitive to touch.
So it's like a sensory hotspot.
You got it. Thinner skin means those nerve endings are closer to the surface, making them more responsive to stimulation. Another key feature is its elasticity.
Elasticity. Why is that so important?
The breast needs to be able to change size throughout a woman's life. Puberty, pregnancy, breastfeeding, even just normal weight fluctuations. The skin needs to stretch and adapt without losing its shape.
So it's like a stretchy fabric expanding and contracting.
It's a perfect analogy. That elasticity comes from the elastin fibers in the dermis, that middle layer of skin.
Okay, so thinness and elasticity. What else is special about breast skin?
It's incredibly vascular, lots of blood vessels, which give it that characteristic pink or reddish hue.
So it's the blood underneath that gives it color. Never thought about that.
Right. And that rich blood supply nourishes the tissue, delivers oxygen and nutrients, and carries away waste products.
Like a lifeline. Okay, let's talk about the parenchyma, the milk-making part.
The parenchyma is what makes the breast a functional milk-producing organ. It's made up of those lobules we discussed earlier, which contain the milk-producing cells, and a network of ducts that transport the milk to the nipple.
Milk-making factories and transportation channels.
Precisely. The parenchyma is embedded in a supportive network of connective tissue, fat, and blood vessels, all creating that perfect environment for milk production.
Teamwork makes the dream work. Does the amount of parenchyma vary between women?
It does. The ratio of parenchyma to fat is different for everyone. This affects breast size, shape, and density. More parenchyma means denser, firmer breasts. More fat means softer, less dense breasts.
Ah, so that's why some women naturally have fuller, firmer breasts.
Exactly. And that ratio can also change throughout a woman's life during pregnancy, breastfeeding, and menopause, for example.
So breasts are constantly adapting and changing.
You got it. They are. Now, let's talk about the inframammary fold, the IMF. Remember, it's that crease that separates the lower edge of the breast from the chest wall.
Yeah, the IMF, we talked about it when we were discussing the breast footprint. What else should we know about it?
Well, it's more than just a cosmetic feature. The IMF is formed by the fusion of different layers of tissue, the deep and superficial fascia and the dermis.
So it's more than just a skin crease.
Right. And it's important for a few reasons. It helps support the breast's weight, maintains shape, and creates that natural boundary between the breast and chest wall. Surgeons rely on that boundary during procedures. Oh, and it contains blood vessels and lymphatics, which nourish and drain the breast tissue.
So the IMF plays a role in support, aesthetics, and even the vascular system. A real multitasker.
You got it. And speaking of support, let's revisit those Cooper's ligaments. They're like the breast's internal scaffolding.
Exactly. But how strong are they?
Well, the strength and integrity of Cooper's ligaments vary from person to person. That can influence breast shape, how prone someone is to ptosis, and even the outcome of surgical procedures.
So some people are just genetically predisposed to perkier breasts.
It's part of it. But aging, gravity, pregnancy, breastfeeding, weight changes, all of those can contribute to the stretching and weakening of those ligaments over time.
So genetics and lifestyle.
Exactly. Now let's talk about the lactiferous sinus, that little holding tank that collects milk before it's released through the nipple.
I remember, it's like a little milk reservoir.
Right. But sometimes it can become a site for bacterial infection, especially during breastfeeding.
Oh no, why is that?
Well, the openings of the lactiferous ducts on the nipple can allow bacteria to enter the breast tissue. And if those bacteria make it to the lactiferous sinus, they can multiply and cause an infection called mastitis.
Mastitis, I've heard of that. It's a painful infection that can affect breastfeeding mothers.
It is. And it's important to treat it quickly with antibiotics to prevent complications.
Wow, this has been such an informative conversation. I'm finally understanding the complexity of the breast and how all those different structures work together.
I'm glad you're enjoying it. It's amazing how much we've learned about the breast over the years, and the more we discover, the more we appreciate its intricate design.
It really makes you appreciate the incredible design and function of the human body.
It does, it really does.
All right, we're back, ready to wrap up our breast anatomy deep dive. I'm still buzzing from all that incredible information. But what's next? Where do we go from here?
We've covered a lot of ground, that's for sure. But now I think it's time to step into the exciting realm of cutting-edge research. What's new in the world of breast development, cancer, reconstruction? Those are the areas where science is constantly pushing boundaries.
I'm ready for it. What's hot in breast development research these days?
Well, one word: epigenetics. It's a hot topic. For a long time, we thought genes dictated everything about us, including breast development. But epigenetics is like this control layer on top of our genes.
So it's not just what genes we have, it's how they're expressed, like turned on or off.
Exactly. And what's crazy is that environmental factors like what we eat, stress levels, even exposure to toxins can actually influence these changes.
Hold on. So our lifestyle choices could actually shape how our genes express themselves. Even something as fundamental as breast development.
That's what researchers are exploring, how these epigenetic modifications might contribute to variations in breast size, shape, and even a woman's risk of developing breast cancer.
Wow. So it's not just nature versus nurture, it's nature and nurture working together in this intricate dance. And epigenetics is helping us understand the steps.
Exactly. And speaking of complex interactions, let's talk about breast cancer. It's a topic that unfortunately affects so many people.
It is. What are some of the biggest breakthroughs in breast cancer research and treatment?
One of the most significant has been in targeted therapies. See, traditional chemo often attacks both cancerous and healthy cells. That's what causes those awful side effects. But targeted therapies, they're designed to zero in on specific cancer cells, sparing the healthy ones as much as possible.
So it's like a smart bomb, hitting only the target and minimizing damage.
Precisely. These therapies are often based on understanding the molecular mechanisms behind cancer growth. For example, some target specific proteins or pathways that are overactive in cancer cells.
So, like disrupting the command center of those rogue cells, cutting off their supplies, preventing them from multiplying.
Great analogy. And thankfully, these targeted therapies are proving really effective for certain breast cancers, leading to better survival rates and quality of life for patients.
That's wonderful to hear. Science making a real difference in people's lives. Are there other exciting research avenues on the horizon?
Definitely. Immunotherapy is showing incredible promise. It's all about using the body's own immune system to fight cancer.
Immunotherapy. I've heard that term, but can you explain how it works for breast cancer?
Think of our immune system as a well-trained army, always on patrol, getting rid of threats. But cancer cells, they're sneaky. They can sometimes evade detection, like they're wearing a disguise.
So they're flying under the radar, free to grow and spread.
Exactly. Immunotherapy drugs essentially rip off that disguise, revealing the cancer cells to the immune system.
It's like saying, hey, immune system, look, here's the enemy. Take him out.
Exactly. And it's showing amazing potential, even for aggressive cancers that have spread.
That's so encouraging. It's amazing how researchers are figuring out how to use our own defenses to fight disease. Okay, let's shift gears to breast reconstruction. It's such an important part of breast cancer care.
Definitely. Breast reconstruction is about helping women regain a sense of wholeness and body image after a mastectomy. And the good news is there are more options than ever before. Implants, using the patient's own tissue. It's a whole new world.
Yeah, it's so great to hear. More options for women to choose from. Can you break down the different approaches?
Sure. Implant-based reconstruction is using silicone or saline implants to create that breast mound. It's simpler, faster, but does involve a foreign object.
So it's all about weighing those pros and cons. What about using the patient's own tissue?
That's called autologous reconstruction. It involves taking tissue from another part of the body, like the abdomen, back, or thighs. It's more complex, but for many women it feels more natural.
I imagine it's a very personal choice.
It is. A woman's age, health, lifestyle, body type, preferences, all those things matter. It's crucial to have a thorough conversation with the surgeon and make the choice that feels right for her.
That's empowerment right there, having control over your body and your healing.
Exactly. And advancements in surgical techniques are making outcomes even better. Microsurgical techniques, for example, have been game changers.
Microsurgery. That sounds super precise.
It is. Microsurgery uses specialized instruments and sutures to connect those tiny blood vessels and nerves, allowing surgeons to transfer large flaps of tissue with incredible accuracy.
Wow, surgeons are like artists.
You could say that. These advancements have led to more natural-looking and feeling breasts, with fewer complications.
That's fantastic news. Even in the face of adversity, there's hope, healing, and the possibility of reclaiming a sense of wholeness.
I love that. It's so true. That's what makes these conversations so meaningful. It's not just about the science, it's about understanding ourselves and the incredible resilience of the human body.
I couldn't agree more. This deep dive has been absolutely incredible. We've gone from the basic building blocks to the cutting edge.
And it's a great reminder that we're always learning. Science is a never-ending journey. The more we learn, the better we can care for ourselves.
So to all our listeners out there, keep asking questions, keep exploring, never stop learning.
Knowledge is power, especially when it comes to our health. The more we understand, the better we can advocate for ourselves. Thanks for joining us on this deep dive. Until next time, keep exploring.